I'm Mrs. Princey, Associate Professor in Mental Health Nursing. Yes, so you've already learned about the personality disorders based on the three, clusters. That is the cluster A, cluster B, and cluster C personality disorder. Right. So today I'll be talking about the role of the nurse when she cares for a patient with the personality disorder. So the topic for today is the nursing management of patient with the personality disorder. So as you know, the nursing management includes the steps of the nursing process. We've got the nursing assessment, the setting, the goal, okay, identifying the problems or the nursing diagnosis and planning the intervention as well as the evaluation. The first important step is the assessment. So in the assessment, the nursing assessment, you're going to collect the information from the patient. You've got the subjective data as well as the objective data. So when you collect the information, so the history of the client, so you have to concentrate on these particular areas when you collect the information. The first thing that you collect is about the childhood history. Since most of the personality disorder clients will have a disturbed relationship with the parents, so it is noted that during the 18 to 30 months of age itself, the person or the child will experience such a kind of a disturbed relationship with the parents, right? So you got to collect the childhood history about the parental relationship with the children, any kind of the abuses that the child had experienced during the childhood period, like any kind of physical abuse or sexual abuse. So it is noted that the person who had experienced any kind of physical or sexual abuses will later on develop the personality disturbances. Also, find out if the client had experienced or underwent any kind of the major abuses, like the even verbal abuses or history of alcoholism in the family. So all these is contributing to the development of the personality. So the childhood history is very much important because that is when the personality will start developing. So any kind of disturbances or impairment or the difficulties that a child has underwent during the childhood period will completely let us know about the personality that the child will develop later on, right? So that is the foremost important history that you're going to collect. So apart from the history, you're going to do a mental status examination wherein you're going to assess the mood and effect of the client, wherein you're going to find out that the client will have a dysphoric, kind of a mood, always being unhappy, restless and malaise. You can also get the reports from the client that most of the time he feels boredom, he is, intensely feeling the feeling of loneliness, feeling of frustration and feeling of emptiness. So all these information or reports that you can get from the client when you do a mental status examination. So what about the thought process as well as the content? If you take the thought process, the client may have the split in the thought process, wherein you can note that the ideas that the client may have, that the other person will have, a very less acquaintance with the client, and also they devalue themselves, that the other person is not meeting the expectation of his or her, right? So these are the disturbances that you can note in the thought process or the content of the thought. The next one is the sensorial and intellectual functioning. So you can notice that there is no, disturbance in terms of the intellectual functioning or in terms of consciousness. So the intellectual capacity remains intact and he is oriented and conscious to the setting. So these are the things that you can notice in the nursing assessment in terms of subjective data as well as the objective data. Right. So moving on to the next step, which is the nursing diagnosis. So what are some of the problems that you can notice in the client? So the first nursing diagnosis that you can state is ineffective coping related to failure to learn or change the behavior based on the past experience or the punishment. The second nursing diagnosis you can state is social isolation related to the ineffective interpersonal relationship, risk for suicide related to the low level of tolerance of frustrations. We can state the diagnosis of risk for self-mutilation related to impulsive behavior, risk for others directed violence related to lack of feelings of remorse. Okay, so these are some of the nursing diagnoses that you can state. Now, what is the goal? What should be your goal? The first goal is the client should not harm himself or the other person or the property. That should be the first goal. The second goal is the client should demonstrate the increased sense of control of his impulses. The third one is the client should take some appropriate measures to meet his or her needs by himself. The client should demonstrate problem solving skills, and also the client should verbalize the greater significance of relationship. Okay, so these are some of the goals that you can plan for the diagnosis. So now, what is the interventions? The person with the personality disorder usually require a long-term, treatment with the psychotherapy. So what are the interventions that we plan? It's closely related to the counseling or to the, psychotherapy sessions, and also the client will have issues related to the family as well as some kind of the abuses. So the interventions should focus on meeting these needs. The first one is to promote the client's safety, since most of the client will have the self-mutilating or self-harming kind of a behavior or suicidal thoughts or ideations, right? You have to see toward the client is being protected. So always try to assist the client and find out if the client is having any kind of the suicidal ideas, suicidal plans, or suicidal attempts, or any kind of the self-harming kind of a behavior if the client is having. So always you should monitor it closely. So that is how you provide a safety for the client. The second one is to promote the therapeutic relationship. Very, very important. Patients with the personality disorders may lack the trustworthy relationship. They may always have the suspicious kind of the behavior, or they may have the hostile kind of a behavior. So always the nurse should maintain such a kind of a setting and a relationship with the client that the therapies whatever she delivered, the client should be able to get the benefit out of it. So you have to be able to understand the condition of the client, accept the client exactly as he is, and follow the therapeutic techniques when you communicate with the client, and develop the therapeutic relationship with the client so that he will receive the treatment in an appropriate way. The next one is establishing boundaries in the therapeutic relationship. So there are some personality traits wherein the client is so much dependent on the nurse for most of his activities. So those kind of the personalities you may require to set a boundary in your relationship. Ensure that the boundary is not being violated either from the nurse's side or from the client's side. The next one is teaching effective communication skill. So most of the clients with the personality disorder will have a problem with an interaction with developing a communication or the relationship. So as a nurse, you're going to teach the client the various better communication skills. It can be maintaining the eye contact or speaking in an assertive way, active listening, taking turns for talking, okay, wherein you give a chance for the patient to explore or ventilate all his ideas or his feelings. The next one is you're going to help the client to cope up with his emotions. So you're going to make the client to realize about his emotions. So make him to develop that insight related to the emotions, why that particular emotion was, put. Right? So what is the reason behind such a kind of an emotion? So you bring an insight about the emotions that he is, experiencing, and also teach him to tolerate his emotions and to have control over his emotions. So at times he may have an impulsive behavior, right? So you need to teach the client to control his impulses, to control his emotions, and gain awareness of it so that he should not harm himself or the other person. So you can ask him to maintain a journal or maintain a diary about his emotions, what situations, what kind of an emotion that he exhibited, and what was the reason for him to exhibit, and what better that he could have done. So all these things can be done when he maintains a particular journal or a diary. The next thing is you're going to reshape the thinking process. So many times a client with the personality disorders may have negative cognitions, okay, will have a very poor, negative thoughts that he will have. So you're going to replace the negative thoughts with the positive thoughts. You're going to give him the positive reinforcement to bring about a construction of positive thoughts and replace those negative thoughts. You can use the behavioral techniques of thought stopping if the client is having a negative thought process. So this is what you're going to bring about a change in the thinking of the client. The next thing is you're going to structure daily activities of the client. So you're going to help or assist the client to plan the activities for the day. So from the time that he wakes up in the morning, so what are all the various activities that he can have? So he can have a journal, he can maintain a diary, he can write those schedules that he has for a day. It can be related to appointment, it can be related to shopping, can be related to reading the paper or going for a walk or exercise or recreational activities. So you can structure the day-to-day activities for the client so that he will be oriented and he will have a plan for the day. So these are all some of the interventions that you can plan generally for the personality disorder. So let us see some of the interventions, especially for the antisocial personality disorder. So as you know, the person with the antisocial personality disorder will be very much hostile towards the other person, who will be always in a thought to destroy the or damage the property of the other person. Okay, will be very much aggressive in nature, violent in nature. So what are the interventions that you can plan for a patient with the antisocial personality disorder? The first thing is you're going to convey to the client that he is accepted as it is, and it is not that the person as a whole is not accepted, but his behaviors are not accepted, not the person. So convey to him such a way that you accept as he is. See to it that you maintain a low level of environmental stimuli so that he will not become very agitated or develop the aggressive behavior. See to it the objects in the in particular setting or the environment where the client stays is limited, okay, free from all the hazardous objects. Encourage the client to understand about hostility, to recognize the hostile behaviors that he has, and also replace the hostile behavior with positive ones. Explore with the client to handle the frustration or aggressive behavior by using the alternative methods that, okay, it can be in terms of physical exercises or running, or in terms of letting out his frustration in a better way, in a constructive way, right? So that kind of alternative that you can give an option to the client when he is under this lot of stress or frustration that he can use. And also see to it that the attitude of the staff should be very much calm when you interact with such a kind of a patient with antisocial personality disorder. And also keep in mind always that the client may strike you anytime. So always have enough number of staff in your units just to show the strength, or just to show the client that anytime he strikes you, you've got enough number of people to control him, so that he will have an idea that he is, he can be having the self-control. And also see to it that you have some kind of physical security around you. So you can also administer some medications, especially the tranquilizer group of drugs when it becomes very much uncontrollable. Mechanical restraints can be applied when you feel that he is cannot be controlled by the medications. You can even go for a restraint with the consent of his or her family. Explain the consequences that the client should face if the violation happens. So you well in advance inform the client that he or she is going to face the consequences, or if he shows the aggressive kind of a behavior or violent kind of the behavior. Whenever the client shows a positive behavior, see to it that you take time to reinforce, you praise the client, give a positive feedback to the client in terms of positive rewards, or in terms of token economy, wherein the particular behavior is an encouragement to be continued. Help the client to gain the insight related to his behavior. So what are the violent kind of a behavior that he had exhibited, and what he could have done during that situation. Bring an insight to the client about his violent kind of the behavior. So when the client is calm, and when you feel that it is time that you make the client realize, you can even talk to the client about the past experience that he had in his life. It can be related to exploiting the other's rights, or damaging and destroying the other's property, or harming the other person. Let him gain an insight, or give him the thought about those thoughts or the experiences that he had, and make him realize, if he was in the similar situation, how would his circumstance be if it is reverse. So make him realize that, and so that he will be able to bring about a modification in his behavior. So these are some of the interventions that you can plan for a patient with antisocial personality disorder. Now, I've got another personality disorder, which is a borderline personality disorder. So if the patient is having, so what are some of the interventions for it? So person with the borderline kind of a personality disorder, maybe usually he may be suspicious, or he may be doubtful. Okay, see to it that you don't observe such a kind of a patient frequently, because he already has a suspicious behavior or a doubtful behavior. Frequent observation can even increase his symptoms. So you need to avoid appearing watchful or suspicious, right? And also see to it that you monitor the behavior of the client frequently, so that you can plan for the various activities and interactions based on the client. See to it that you set a contract with the client. So whenever he is having a self-mutilating kind of a behavior, that he has to approach the staff for, so that he can seek out the help. If at all the client is having the self-mutilating kind of a behavior, it occurs, then you have to make sure that you care for the client's wound, and also see to it that you don't sympathize with the patient, which will give him a clue that he can be getting that attention from you. No, so always see to it that you don't give a sympathy to the client, and you don't reinforce such a kind of the behavior. So as much as possible, you can assign staff on a one-to-one basis if that need arises when is so much into self-mutilation. Encourage the client to talk about his feelings. So what is that which made him to end up with self-mutilation. So give him a positive reinforcement whenever he attempts the better way of coping. You can set the limit on acting out of the behavior. Since most of the time these kind of the patients are so much dependent, see to it that the staffs are rotated on a frequent basis, so that he will not depend on a particular staff for meeting his or her need. Another important feature is that the client will always have a fear of abandonment. He will have a feeling of clinginess or attachment that he will develop. So you have to explore that feature, and also teach the client that this is not the accepted behavior, and this kind of a behavior is really going to interfere with the satisfactory relations, right? So that has to be discouraged. So these are the interventions that you can plan for a patient with a borderline personality disorder. Now, moving on to the evaluation part. So you see to it that the goals what you had set is achieved. So the goals which are met can be evidenced in the evaluation step by knowing these things. So that is, the client is safe and free from significant injury. The client has not harmed himself or the property of the other person. The client has demonstrated the increased sense of controlling the impulses. The client has taken the steps to meet his or her needs. The client has demonstrated the problem solving skills, and the client has verbalized a satisfactory relationship. So, if these goals are met, then you can state these things in the evaluation step. So, these are some of the interventions and the nursing problems that you can notice in a client with the personality disorders. Hope you all have understood the topic. Thank you.